Since 2015, Pop Health Podcast has brought to you some of the best minds in healthcare, including leaders from government, not-for-profit, and investor-backed powerhouses, as they share successes, failures, and how our audience can move forward in today's constantly evolving healthcare world. Thank you for joining us for today's episode presented by 24 Hour Home Care.
Hello, everyone, and welcome to another episode of Pop Health Podcast. I'm Gavin Ward, host of Pop Health Podcast. In today's episode, I had the privilege of sitting down with Joanna Allboe, who serves as the section chief for the division of DHCS that oversees community supports in the Managed Care Quality and Monitoring Division. In today's episode, we learned a little bit more about the primary and secondary measures that managed care plans here in California are being measured on, if you will, by DHCS to help ensure that Medi-Cal transformation and the CalAIM initiative really continues to grow, not just in utilization, but also in quality as well. In today's episode, we learned a little bit about Joanna's journey from a small town girl where a dentist was an inspiration for her to get into public health, where she started to go down the dental hygienist route, but ultimately ended up in more traditional public health and ultimately coming back to California, where her hometown was, to serve with DHCS. We hope you enjoy today's episode. Feel free to check out other episodes of Pop Health Podcast by visiting us at pophealthpodcast.com or checking us out wherever you listen to your podcasts. Thanks, everybody. Enjoy today's show. Joanna, thanks so much for joining the show today.
Thank you, Gavin. Thanks for having me.
Absolutely. I was sharing with your colleague Tessa and folks behind the scenes. I've been so eager to learn about the primary and secondary measures with DHCS, and it's taken a few weeks to get you on the schedule, Joanna. So thank you so much for joining. I know our audience is very eager to learn from your expertise. But before we do that, we like to get to know you on the personal side a little bit, Joanna. So can you tell us something about yourself, ideally outside of the workplace? That's like a fun fact, hobby, something like that.
Hey, yeah. So hobby-wise, I did take up a new hobby recently. I started road biking. About a used truck bike right now. It started out as a way just to stay active, relieve stress, but it's really turned into something I genuinely look forward to. So I started this fall, was quite a bit warmer. I rode several miles a week outdoors, just exploring new routes and enjoying the sunshine. Now that it's winter, I've really transitioned into this indoor biking.
Okay.
And it's still a fun way, to keep the momentum going. I think what I love most about biking is that it clears my mind and it reminds me that movement is progress. So it's become kind of this metaphor for how I'm approaching new challenges. Like, as long as you keep moving forward, you're making progress. And what's behind you is just, part of the journey.
That's good. I like that when you mentioned momentum early on when you were talking about it. It made a lot of sense to me. So when you're doing road bike, help the audience know, because I'm not big. I like biking. I have a beach cruiser, but I don't know. I've heard the phrase road bike. Tell us what that means exactly.
Yes. So these are bikes that are made for the road. I'm learning all kinds of new things about it. They're very light. You wouldn't believe. I think this bike is maybe 14 pounds. It's just very, you could just pick it up and put it in your car. There's, big communities. Like I'm going to go on a trip in April and ride up Highway 1 in California along the coast. I don't know. There's a lot I could tell you about it.
Yeah. So Highway 1 is Pacific Coast Highway, which is a very famous highway for those of you who aren't familiar. So I'm guessing that's going to be very scenic. Are you doing like a very windy, like with lots of hills too, or?
I'm not sure. This is a new experience for me. Okay. Yes. It's supposed to be very scenic. We're going to see some lighthouses, of course, the ocean and some cliffs. And I'm expecting some hills. So yeah, I'm doing some training right now. And it's very challenging, but it's a good thing.
I bet. I'm a jogger. And so when I get on a bike and I actually have to feel a lot of resistance on my legs, I feel it for sure. So kudos to you and that the road biking and getting strong. That is great. And I like that you don't make excuses in the winter, right? You keep doing it just on the inside.
Yeah, you got to keep up that momentum, right? You got to keep up that strength. Yeah.
That's great. Well, let's shift over to a little bit of your background, Joanna. We're going to talk today mostly about your work at DHCS and what the primary and secondary measures are within like Medi-Cal transformation, for example. But before doing that, tell us where you grew up and kind of your background and how you kind of ended up in healthcare.
Yeah. Um, well, I grew up in a very small community just north of Sacramento, California. And yeah, I would say, my parents really emphasized the importance of giving back and making a difference in our community, no matter how big or how small. And so, one pivotal moment that changed my career path that I could think of growing up in that small community was our local dentist, and how he took care of my family neighbors. He did a lot of outreach and some mission trips, and I think it really, in a positive way, impacted our county. So, I always felt like that office. Yes, they took care of our teeth, but it was really our overall well-being, right? So it opened my eyes to how, health can impact every aspect of a person's life, how healthcare professionals could make a difference in people's lives. And that influence really carried me through to my education, where I pursued a degree in dental hygiene and then later public health. So it became clear to me that working in healthcare, especially in public service roles, was a way to contribute to something bigger than myself. So I wanted to ensure that others, particularly underserved communities, had access to care and the support that they needed.
That is great. Do you mind me asking the dentist's name if you know it?
Yeah, Dr. Schroeder.
Dr. Schroeder.
Fred Schroeder. Well, yeah, he's no longer with us, but
I'm sorry to hear that. But if your, I don't know, family by any chance will listen to this episode, but what a honorable shout out to Dr. Schroeder.
He's great. Yeah.
Yeah. And you talked about the work in the community. It reminded me, I was actually at the dentist last week for a checkup. Thank God. Nothing major no follow-up visits. Thank God.
That's right.
But he, Dr. Schroeder and my Dr. Chung, their hearts seem very familiar. I wonder if it's a theme among dentists. But I'm really glad that you had that experience. Before the show, as I was prepping, doing some last minute work, I did notice some of your experience prior, I believe, to your current role. So let's get into, you mentioned like serving the community, getting into public health. Tell us, you mentioned dental hygienistry. I don't know if I'm saying that right, but where did you go to school for your dental background, and tell us how you eventually got into public health from there.
Yeah. My professional journey has kind of been winding, but very rewarding. So yes, I started my career in dentistry as a dental hygienist, like I told you. So I grew up in Northern California, but I had moved away for a while, and now I'm back, so I'll explain that. But I had moved to Kentucky. Okay. To Lexington, Kentucky. And so I attended a community college there, Lexington Community College, and that's where I got my degree in dental hygiene. And it really gave me, an up-close view of patient care and barriers many people face when it comes to accessing healthcare. And it really sparked my passion for addressing health disparities. And this is what drove me to pursue a degree in public health. So I was working in clinical practice as a dental hygienist. And the program I graduated from said, hey, come back and teach some courses, help us out on Fridays. And it was interesting because they, at that point, they said, okay, now you have to go for your master's degree. And most people in that position for dental hygiene would follow and not continue with like, I'm going to get a master's degree in dental hygiene, but I chose public health. Yeah, and so what happened is I did an internship with the University of Kentucky College of Dentistry, that a division of dental public health. And as soon as I graduated, they offered me a job.
Nice.
So it was like a really nice, promotion, and working for the university. So I ended up as the program director in the division of dental public health, and even served as the interim division chief for a time. And I learned a lot about research, outreach, how to lead teams, design programs, and, focus on education and prevention.
Wow. So it's coming full circle from that inspiration as a young lady in Northern California to being a leader in Kentucky. So tell us from there, what happened from there, and how did you end up back in California?
Yeah. So, I returned to California for some family matters, and I took on a leadership role at the California Department of Public Health. And from there, I came to the Department of Healthcare Services, DHCS. And, I just feel like at DHCS, this is where I've really found my passion for bridging the gap between policy and healthcare delivery.
Yeah.
I've been working with these ECM teams. That's the Enhanced Care Management team. And my section leads the community supports efforts, which is what we're going to talk about today. And it's just been incredibly fulfilling. It's really allowed me to just work at that intersection of innovation, health equity, meaningful change. It's like all come together. Yeah, so I would just say, like, looking back at each step of my career, just from clinical care to policy leadership, it's really shaped how I've approached challenges and built relationships, and just focusing on that big picture and improving health outcomes, especially for vulnerable populations.
Yeah, good for you. So I want to talk about your department. So I have in my notes. It's the DHCS titles and departments can be very lengthy. I think a lot of our audience are familiar with the CalAIM or Medi-Cal transformation, about enhanced care management, community supports. What's the department or division that oversees, let's say, for example, community supports?
Yes. It's a very big organization. And we are in the managed care quality and monitoring division. And then it's broken further down by branches and then by section. So yeah, we affectionately call it MCQMD, Managed Care Quality and Monitoring Division. And then my section, the Program Administration section, was what oversees community supports. Now, it is interesting because ECM, which is Enhanced Care Management, it is in a different division, Population Health Management. But the two programs work very closely together.
Yes, that makes sense. I like how you say we affectionately call it by the acronym, and when you say it, it's so when usually people are joking about it, but I find you joking about it, but also sincere based on your background and your passion, right?
Yeah, yeah. I think I was kind of laughing because we use a lot of acronyms.
Oh yeah.
So my first, right when you first said that, the first thing that came to my mind was MCQMD.
Yep, but I slow down and explain to all of us lay people, what that means. Okay, so that's great. So your division oversees community supports. Mm-hmm. Most of the audience, I would say at this point, not all, but most of them are familiar with Medi-Cal transformation, the CalAIM initiative over the last few years. We're now in year 4, right? Because we started in 2022. We're completed 3 years. And here in 2025, we have these tools or measuring sticks, whatever you want to call it, called primary and secondary measures. Would you mind sharing with our audience, and please take your time to help us really understand what does that mean for our audience, especially those in California who are providers, for example?
Yes. Yeah. Okay. So, just in case the audience is unfamiliar, so CalAIM is the California Advancing and Innovating Medi-Cal. And I would say, this represents a transformation of Medi-Cal, and it's really aiming to improve health outcomes and address social drivers of health. What's most exciting about the Medi-Cal transformation is it means that Medi-Cal members have access to new and improved services to receive well-rounded, whole-person care that goes beyond the doctor's office or the hospital and addresses all physical and mental health needs. So starting with ECM, the Enhanced Care Management. So this was designed to provide person-centered intensive care coordination for Medi-Cal members with complex needs. And ECM focuses on connecting these individuals with care and the support they need. Whether that might be managing chronic conditions, navigating transitions like hospital discharges, or even accessing mental health and substance use services. And then community supports are services that are optional. Okay, and these are innovative services that address health-related social needs. And they might include things like housing supports, medically tailored meals. So there's 14 in total, and we're adding a 15th soon. It's called transitional rent, and that's going to come out later this year. So these services are a complement to traditional healthcare. They're helping members stay healthy in their communities. And I would say, we have online on DHCS website. If you just Googled ECM, Community Supports DHCS, you'll find the page, and there's some really great information. So because community supports are optional, the managed care plans elect to provide, an array between up to, soon to be 15 services. So you could check with your managed care plan to find out which community supports they offer. So today, both programs work hand in hand to ensure that the managed care plans can deliver benefits and services effectively. And when we're talking about these primary and secondary measures, it's part of our monitoring plan. So now that we are, like you said, and 4 years into this, we want to look at how well things are functioning.
Right.
And so we're monitoring, and we're looking at provider networks. We're looking at increasing member access to services, and of course, continuously improving the quality of care provided. And so when we talk about these monitoring and the measures, I'll just explain that our goal of the monitoring effort for ECM and community support. So, our main objective is to ensure that managed care plans are providing ECM and community supports to the members who need them, and that they're provided on time and in line with DHCS policy, and in a way that supports care management, right, and health-related social needs. That's really important. And so, in order to achieve this, there's 3 key priorities.
Okay.
So first, we want to ensure a sufficient network of ECM and community supports providers. The second one is we want to increase access to and uptake of ECM and community supports, increasing access to and use of these services. And 3, improving how ECM and community supports are delivered to the members. So now we're back to the monitoring. It's now to track the progress, we've set up a few types of monitoring measures. So primary measures, these focus on whether the managed care plans, the MCPs, are following DHCS policy, and they have to meet specific performance thresholds. So that's what primary measures are. And the secondary measures, these look at how well ECM and community supports are being delivered, but we did not set a minimum threshold. Okay. And then the last one is what we're calling feedback and event priorities. So these include reports from members, providers, and even the media, as well as other qualitative insights that might help us assess how things are going.
Yeah.
Yeah.
Okay, so what, I guess, are there more examples? And if you don't have any, that's fine. On the primary measure, what's an example of, let's say, increasing or uptake, for example? How would a health plan or a community be measured on that? Is it a number of individuals that are receiving the service and accessing the service? Is it the number of hours that are actually used in a service? What's an example of uptick, I guess? So
for now, for 2025, because this plan will expand in 2026, we're going to add some things to look at. Okay. But again, these had to be within policy and measurable, right? So our one that we're looking at is called a 12-month referral growth.
Okay.
And we're looking at a specific period from July 1, 2023 to June 30th, 2024. And so we are looking at the growth number of community supports, those community-based referrals in that 12-month period. So that's kind of how we're measuring that.
Okay, so is that the period that's a baseline for then future growth?
Exactly. Okay. Yeah, and where that came from is there was a summit that was held. Okay. And an action plan that was released, and at that point, they were that was the recommendation to increase referrals. So we were kind of looking at, because that was said during that summit. Let's go from that period to for a year to see what referral growth there was.
Okay, got it. And then if I won't go into the nitty gritty, but let's say a county or a health plan is struggling with meeting these goals or reaching these goals? Do they get on any? Is there any type of accountability, or are they like? Are you guys come alongside and say, "Hey, let's work on some performance improvement"? Like, how does that work?
Yep. So we start out with a performance improvement plan.
Okay.
So we're going to meet with the plans at least one time a year, kind of like on a one-on-one. And we have these measures that we're tracking and the thresholds. So we have more or less, I don't know a better word for it, but like a report card.
Okay.
So how are they doing with these measures? And we're looking at the data. And if we see an issue, then we'll talk about a performance improvement plan to say, this is what we're seeing. We're providing what we call technical assistance. So it's basically like how can we help? What kind of information you need? And these calls will also, it won't always be like you're not meeting a threshold or you're not. Another one of our goals is to say, how well you're doing so well. Tell us what's working. We want you to be like, give us some best practices. And then we can then use those also for the technical assistance we just call TA. So when we're providing TA, so it'll be like some group peer learning as well. We have monthly, we call them TA calls, so technical assistance calls. And so we will have those that are doing well share what are your best practices, what's working well. Mm-hmm.
That's great. So these, there's obviously a lot more to this. We don't have time to get into all the nitty gritty of the primary and secondary measures, but is there a place online? I've been to a few webinars where I've received information on them, and I've actually shared them with a lot of folks who are interested. But if folks are listening today and they maybe have missed a webinar on it, where can they find more details on primary and secondary measures?
Yes. So I don't know that we're going to publicly post those monitoring results, but definitely we are posting how well ECM and community supports are doing through a quarterly implementation report. And that is online. So if you go to the ECM community supports page at DHCS, if you just Google that, it'll come right up. And you'll see the link for the quarterly implementation report. And it'll show you, they have different breakdowns for both programs and information. And then, I would say, go ahead.
Oh, sorry, Joanna. I think I did a bad job asking the question. By the way, the data that you just referenced for the audience, it has been super helpful for me. So thank you for bringing that up to the audience as well, how they can see the results of, I think they're usually about 6 months behind, right? Because it takes a while to collect all the data. So I think it's through Q2 of 2024. Yeah. Is that what the most up-to-date one is, I think?
Yes.
Yeah, so that's great. And I don't intend to look at the results of how the health plans are performing, but more so just how they're being measured. So right. Not the results, but is there a place where people can learn what are the primary measures, like growth, for example, is one. So is there just like basic general information on that, or is that not publicly available?
I don't think that we have posted that yet. So I can tell you that for community supports, we have the 12-month referral growth. We have the active provider network. So what that means is that we are looking that each county has an active provider for the community supports that they have elected to provide. And then each managed care plan has a website. And on that website, they're supposed to provide information for members and providers. So we will be reviewing their webpage to ensure that that information is there. So those are the community supports primary measures. And then for ECM, they're very similar. So they have a 12-month growth.
Okay.
They have the provider network, and then they have also provider type diversity and percent of members receiving ECM. So those would be the primary. I don't know that those have been posted online, but they have been shared with the managed care plans. I do have an email to share with you. If anybody had questions, if they wanted any specific information on this topic, our community supports monitoring team has an email inbox. So it's CalAIM, CalAIM, ECM ILOS. So CalAIM ECM ILOS at dhcs.ca.gov. And just for a little FYI, the ILOS is in lieu of services. So our community supports are in lieu of services. It's kind of like a federal term.
Thank you so much for bringing that up, because I think folks who might be relatively new to this world in the last year or two, they might have missed how initially, right, community supports was called in lieu of services, or ILOs. Right. So I really appreciate you calling that out. I was gonna quiz you and ask you why they have that. So you beat me to it. And I've used that inbox, folks, and received questions. Sometimes they need time to research the question and get to the right department to get the answer. So I've had times where they've responded like within a few minutes, and other times it's taken a few days because they need to get to the right person. So definitely use that email, folks, that Joanna mentioned, because they do want to help. They do want to help you and answer and provide clarity if they can.
Yeah, so and like you said, we're very responsive to that email. So we'll communicate. Usually, like you said, we can respond almost immediately. And if it's something we have to confer with another colleague, then it might take a bit, but we'll communicate that so you're not left hanging.
Definitely. And I want to applaud the team for that. I know for folks who first enter like healthcare and hear of big bad DHCS, it might be intimidating, but really you're just like the rest of us, super friendly and helpful. And yes, you're an authority and you're a regulator, but at the same time, we're all here to help, or you're here to help us.
We have an amazing team, and they're very passionate about what they do and ensuring, that members get the services they need. So yes, definitely.
Awesome. So today, while we talked about your backgrounds and your role, how you got into it, a little bit about primary and secondary measures, the whole Medi-Cal transformation phrase or the CalAIM initiative, there's a lot to it. And I think a lot of folks that are listening in to just get a little preview of primary and secondary measures, they're going to want to stay up to speed on what's happening with Medi-Cal as a whole. So I know there's so many different webinars, right? The DHCS does so much. I didn't prepare you ahead of time for this, but if you're a member listening in and like, how do I stay up to speed just with the whole Medi-Cal transformation, is just Googling DHCS and CalAIM the best bet? Do you have any particular recommendations on how to best stay in the news?
Yeah, I would regularly check that quarterly implementation report. I believe that really has the most up-to-date information on how well the program is doing. And that page, the ECM and community supports page, that will have all the new information, like with transitional rent, the new community supports that is coming out, the information will be there. And there are some of our webinars that are really geared towards help, the managed care plans. But again, you could reach out to us via that email inbox to ask about upcoming webinars.
Awesome. And I've attended a few of those for learning purposes, and it's been super helpful. They're very well organized. I mean, extremely well organized. You might have like 10 speakers, but boom, 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 boom. And you get a lot of good content and quick snippets, which I really appreciate, Joanna. So we talked about the data, which is great. Talked about how to stay up to speed. I'm looking at my notes for today. I think that's what I wanted to cover in today's episode, Joanna, but I wanted to make sure you had the opportunity to touch on anything else that we haven't touched on today when it comes to your world there at DHCS.
Yeah, I would just really want to share that, the results so far have been really promising. And, they highlight the impact that ECM and the community supports are having for Medi-Cal members across the state. Those quarterly reports will really give you information about this sustained quarter-over-quarter growth that we've seen with both of these programs. They will give you information about populations of focus that are expanding statewide, such as our newly introduced birth equity population of focus and individuals transitioning from incarceration population of focus. So both of these were launched or expanded in January of 2024. And so, you can just find these key members about, almost 250,000 Medi-Cal members receiving ECM benefits, and how many were served, and that this represents more than 50% of an increase in the quarterly ECM members since 2023. And so we're just really pleased to see that so many people have access to the services, and that this represents just an increase of community supports members receiving additional health-related services. And we're just really proud of this program. And I just really encourage everybody to read those quarterly reports to see how well things are going.
Yeah, and I will continue to do so as well, Joanna. Like she said, the reports are very easy to read, easy to follow. I appreciate the effort into making it user-friendly, Joanna. So whoever the designer was or designers are, thank you for making it easy to navigate. So folks, check that out. Do you happen to know, Joanna, how often? I know they're usually maybe a quarter or two behind. Do you know? I think the last one was refreshed in December. Do you happen to know? Is it would March be the next one then, approximately? Do you think, or any idea there?
We should see by May.
By May, okay.
Yeah.
Gotcha. Okay, cool. Well, Joanna, anything else?
Not that I can think of right now. I mean, I have a lot, but we have limited time. So maybe you'll invite me back.
Absolutely. I would love to have you back, and really appreciate you sharing your journey today. And again, for Tessa for setting this up today. Folks, again, that CalAIM ECM ILOS email address, I'll try to remember to have it posted if you're watching on YouTube so you can see it. And lots of good information on the website, the implementation, reports that show quarterly data, and that growth that Joanna was talking about. You'll see that. So again, Joanna, thank you so much for joining today, giving us a little snippet of what y'all do there and the great tools that we can use ongoing to follow Medi-Cal transformation. Thanks so much for joining today, Joanna.
Appreciate it. Thank you, Gavin.
Thanks everyone for tuning in to another episode of Pop Health Podcast. We hope you've enjoyed today's episode, and if you have and want to check out other episodes, visit us at pophealthpodcast.com, iTunes or Apple Music, Spotify, Stitcher, and now YouTube as well. Take care.